My dear friends, today I am uploading this video in which you will see how to deal with hypermature cataract. See, after making both sides side port, inject 0.6% trypan blue dye, wait for 10 seconds and then wash the eye. It will stain enter capsule, and now see what happened when I start to do rexis. In such type of cataract, as soon as I entered into the AC and picked the lens capsule, pultaceous material, that is liquid cortex, came out into the antechamber. See how it is coming out from the capsular bag. I am trying to make a continuous curvilinear axis of adequate size. Now inject 2% HPMC again, and then I enhance the magnification. Now I am trying to continue this rexis. Visibility is slightly poor because of less staining of the lens capsule. Even after that, rexis is completed nicely after few seconds. Now the rexis is completed. After completing the rexis, make a main port by using 2.8 steel keratome. This is basically biplanar incision. It is not triplanar. Now do the slightly hydro procedures. Hydro procedure is not required in such type of hypermature cataract. Inject HPMC and then rotate the nucleus. Now in this case I will do the modified direct chop technique, in which first of all I will emulsify some superficial cortex, adjusting the Phaco needle size, and now in US1 mode I am sculpting the superficial cortex and making the trench of adequate depth and size. After making the trench, now go to the US2 mode, where the vacuum is slightly higher. Phaco power is also slightly higher, and then divide this nucleus into two heminuclei. Again divide each heminuclei into fourth quadrant like this. Separate each piece from other. At this time, I decided to emulsify this quadrant. Now rotate the heminuclei, embed the phaco tip, and then hold, and after that divide it into another two quadrants. Now I am emulsifying each nuclear piece one by one. In this case, I am using Phaco power 60, vacuum is 300 and flow rate is 70. Always try to pick up the quadrant from the apex of that pyramidal quadrant. Don't waste the phaco energy inside the anterior chamber. Always bring the nucleus from periphery to the center and then emulsify it. At this time I am in US 3 mode, where the vacuum is slightly low. It is 200, Phaco power is 60 and flow rate is still 70. That Phaco parameters are very important. It depends on the machine to machine and person to person also. After emulsifying that last piece, remove the phaco tip of phaco probe and then inject the HPMC. Hydroxypropyl methyl cellulose is very important. Its use at a right time is also very important. We can prevent the endothelium while doing the phaco surgery in such type of hard cataract by repeated use of this HPMC. Don't leave any cortical fiber inside the bag. Again, inject the 2% HPMC and now implant the IOL in such a way that the leading haptic should go into the bag, and then dial the trailing haptics like this by using this lens dialer. Now lens is in the bag. Again, clean the entire anterior chamber, remove the remaining cortical fiber if they are remain, and then inject 0.1 ml pilocarpine, hydrate the wound, hydrate the both-sided side port, check the integrity of wound. This should not be leaked. Now do the final lavage. Replace entire fluid or BSS from the antechamber